Welcome to The Rounds. I'm here today with Dr. Sandy Meltzer, Executive Vice President for Networks and Population Health here at Seattle Children's. Sandy, thanks for being here.
Thank you.
So you have spent part of your career at Seattle Children's building the largest distributed network of any children's hospital in the country. Tell us a little bit about that work.
Well, Seattle Children's is quite unique among its peers in that we have the largest service area of any children's hospital in the country, about 22% of the U.S. landmass, which includes the states of Washington, Alaska, Montana, and Idaho. And over the last 15 or 20 years, we've been working steadily towards delivering care closer to home.
Who's a good partner, a good relationship or collaborator for us?
We assess primarily for mission fit to make sure that they share our commitment to take care of kids and especially underserved kids. We assess a quality commitment because Children's has such a high quality standards. We want to make sure that anyone we work with can do that.
How do these kind of collaborations and relationships help us impact the health for a broader number of kids?
The first is really our partnership with primary care. But in the new world of healthcare, that really requires us to take longitudinal care of populations of patients. You have to have a robust primary care partnership. And so through our Seattle Children's Care Network and other vehicles, we have established these partnerships and are now very successful. The second piece of it is really around community health, that there's a growing body of evidence that suggests that a child's physical health is integrally linked to their external environment and what we call the so-called social determinants of health. In fact, there's lots of very high quality, experienced, credible community partners that can help us with that.
Why do these partnerships matter to our kids and our families?
The partnerships really matter to families when it means that they can get care closer to home. Being able to see a children's neurologist in Yakima in person versus having to drive over the mountains to Seattle, especially in bad weather, and take a full day or two off work to do that makes a big difference. What we've been able to do in Yakima County in the last almost 20 years has been extraordinary. This is an impoverished county with a lot of very significant health challenges. And we have a long-standing relationship there, both with the Yakima Valley Farm Workers Clinic and the local hospital and some of the practices, and we've really been able to impact access to care for a group of underserved patients.
How do these relationships and collaborations give our families more access to clinical trials or the ability to determine outcomes?
Probably the best example of that is the work that we're currently doing in immunotherapy at the Seattle Children's Research Institute. And what's apparent about these types of partnerships is that they are frequently require some type of an industrial partner that has a combination of the expertise, the capital, the infrastructure that it really takes to make these successful.
How do you see things like innovation, technology, telehealth, being able to expand our relationships as we think about collaborations that way?
The historical model of having to physically send a physician or a provider to remote locations for everything is really increasingly impractical. And we're very excited about the use of telemedicine to expand our reach, especially to the more areas that are remote to us. And in fact, we're one of the national leaders in telemedicine starting back in early 2000 with a big grant to build the first pediatrics-only telemedicine network. I see a huge future for Seattle Children's with telemedicine, especially given the vast geography that we cover. So I think if we're able to do all those things, to fulfill the mission, to expand access to care, to make sure we do it in a high quality way and provide a model for this around the country, this would be a very exciting future for us.
Thank you for representing children so that we can continue to impact more kids.
Thank you for the opportunity.
And cut.